why don't you tell me a little bit more about who you are and what you do?
Absolutely. I'm David Perdue. I am the founder and principal of Navatar Health. We are a digital health company. We've just started in January. We've developed a digital platform that's designed to engage patients, educate them, and support them to make better health decisions and have better health outcomes. We're starting with colorectal cancer. I'm a gastroenterologist by training. Spent the last 20 years seeing patients, but also doing health equities research. And so we know what we really need to build to engage patients. So,
very nice. So what brings you specifically to Startup Week?
Again, we're a new company. So we started in January. We've had a lot of traction. I've got a CTO. We've got a head of AI engineering. We did the beta program here in Minneapolis. We were a finalist in the Minnesota Cup, which we felt good about. We're pre-revenue, pre-investment, pre-pilot. So we felt really good about that.
Yeah.
So just trying to learn, try to catch some sessions.
Awesome. Is this your first year coming here?
It is my first year.
Okay. Awesome. Yeah. So a couple of the people that came before have been here a couple of years in the row. What do you think so far? Did you do anything yesterday?
So last night was just the Minnesota Cup. So we had a table there and we talked to probably 100 people in an hour and a half, and then they had the finals.
Right.
After that, we did a social event with one of the startup founders, our startup investors.
Nice. Yeah, I would imagine that even if you're a finalist, even if you don't win, you're probably still getting a lot of traction and a lot of eyeballs on what you're doing.
Yeah, it's the whole Minnesota Cup process is just a wonderful experience. It helps you really hone your business plan, helps you learn how to pitch and get things tight, talk to a lot of people, you get mentoring. It was a fabulous experience.
So what are the next steps? Where are you going from here?
Next step for us, so we've got a beta platform. It just came out in August. So people can actually check that out and get on there and see how our avatars work. So the name of the company is Navatar Health, which stands for Navigation Avatar. So we use AI avatars as nurse-educator, nurse-navigators, and they sit next to BeReal, which basically does the patient education. What's cool about using AI avatars is that we can put them out in multiple languages and also multiple ethnicities, so our whole platform can adapt to the patient. So if you got a Chinese patient, you'll have a Chinese-speaking avatar, and even the BeReal, everybody will be appear Asian in the BeReal. And we know that that's just more impactful, engages people better, and drives better results.
So BeReal, explain that.
Well, so when we're doing our educational platform, on one side is the avatar. So think of an avatar that's talking to you, do the education.
Sure.
BeReal is the other side of that exact same screen, but it's showing content. So, if you're talking about the digestive tract, and it's talking, it's showing illustrations or those sorts of things.
Okay. So like I live in a video production world, so it's a lot like B-roll. B-roll is kind of like supporting material that kind of helps drive the concepts home in a little bit more clear way. Awesome.
100%.
Cool. So you checking your watch, or you're not in a rush to head out?
I'm not. I just get a call. I've got my glasses being delivered.
Okay, perfect. I just don't want to hold you up if you need to hold on to something, but definitely interested to hear more about your story. So
yeah.
Tell me a little bit of background. I mean, obviously this is a new thing that you're doing,
100%.
but this idea came from somewhere.
Right.
Tell me about that.
Right. So again, for 20 years, I've done health disparities research as a gastroenterologist. Started at the University of Minnesota. I helped. Most of my work was with American Indian populations, Alaska Natives. We founded the Minnesota Intertribal Colorectal Cancer Council. We did a lot of work with a program called Wisdom Steps. I left the university, I guess it was about 16 years ago, and founded the American Indian Cancer Foundation, which is located here. I was the chief medical officer there, and splitting my time between that and Minnesota gastroenterology, which is now called Minji Digestive Care. So I was doing clinical work there, working as a CMO. Eventually got the foundation up and running, came over to Minji. I was on the board, was chief medical officer of our program, of our practice as well. And during that time, I just started to see just how leaky this colorectal cancer screening value chain is. For a lot of practices, up to 45% of patients who are referred for screening colonoscopy never actually get that colonoscopy. And other types of screening have the same problem. So we've been meeting with Exact Sciences. 30% of people who have a Cologuard order for them never actually complete it and mail it back. So there's a lot of ways that we can engage patients, educate them, and try to increase screening. Colorectal cancer is the second leading cause of cancer death in the United States. And it's at least 65% of those cases can be prevented. 65% of deaths can be prevented through screening and early detection. So that's really where we're landing. Our platform is built to scale into other health journeys. There's kind of like disease management, but we're starting with colorectal cancer.
Awesome. So to wrap things up, if you could leave our audience with one piece of inspiration, just something that inspires you, gets you out of bed every day, or something that you feel could just help people as they're on their journey to life.
And yeah, I was speaking with a founders group down in Shakopee a couple weeks ago, and I told them, I went through undergrad, grad school, medical school. I've never done anything as difficult as being a startup founder in all the everything that comes with it. You're just wanting to scale yourself, trying to find funding, trying to hire the right people, trying to make your message resonate, right? It's one of those things that, at 2 a.m, you're really thinking about it. But I've also never felt so fulfilled in doing something. So I would say that, if you can follow your dreams, you got that hunch and you really have something and you've got a good sense that, other people are telling you that you've got an idea that could have traction, take a chance.
I like it. Yeah, awesome. Well, thanks for joining us today.
Appreciate it.
Hey, it's Will with the Podcast Crew team. Spotlight is a vidcast shot at the Podcast Crew studios in Minneapolis. We would love for you to be our guest. Email us at the email address on your screen below to get a copy of the upcoming schedule. It's free, it's easy, and it's a great way to try out a podcast or a vidcast with our pro team. We do an in-person, in-studio version if you're in the Twin Cities area, and also an online version if you're somewhere else. We'd love to have you, hear your story, and help you start your podcast journey. Thanks. Get in touch today.